The wave of Omicron is now well and truly upon us. Around 3 in 4 cases are of this new variant, with numbers only set to rise. We've already had new guidance from the Prime Minister, hence why I'm recording from home instead of our independent headquarters. As we head into winter, the spread of Omicron is only going to get more concerning. I'm Rebecca Thomas, I'm the new health correspondent for The Independent, and so I'm here to answer your questions about the new variant. Well, Omicron is a mutation of coronavirus, so as with the Alpha and Delta variants, it is a coronavirus, but it's a mutation of it. The important thing to know about Omicron is that so far it looks like it's far more infectious than the previous variants. So Omicron is spreading at a much faster rate. Its infection rate is doubling every 2 days. Although we don't know too much about how this variant affects people, that's the most important. That's the biggest difference right now. Symptoms right now, as scientists have pointed out, they're similar to the common cold, so headache, sore throat, runny nose, fatigue and sneezing. In terms of them being less severe, scientists are still waiting for accurate data on whether it's less likely to lead to hospitalizations. We don't know that for sure yet. Chief Medical Officer Chris Whitty warned the data coming from South Africa can't strictly be applied to the UK because South Africa will have had different immunity levels from the Delta variant because of the timing of their wave. We're still waiting a few weeks to see whether hospitalizations here, for example, are going to increase at the rate of Delta. Well, Omicron seems to have an alarming rate of growth at the moment. It's in the tens of thousands, and the UK Health Security Agency is predicting it will reach 200,000 infections a day, which is quite staggering. Essentially, yes. A lateral flow test or a PCR will be able to tell you if you've got COVID, if you've got an Omicron strain, if you've got a Delta strain. It will still pick up that you have COVID. No, not for people who are vaccinated. So experts are suggesting so far that people who are double vaccinated may have less protection than Omicron than they would have Delta and Alpha variants. However, with the booster jab, they're hoping that will top up immune systems enough to be able to battle Omicron. Getting your booster and double vaccinated is the best line of defense, really, at the moment. As you know, Plan B now means that face coverings are compulsory in most indoor venues, apart from hospitality. People have been told to work from home where they can, and the COVID pass is now going to be mandatory for large venues and nightclubs. As to how effective that plan is going to be, I mean, the government is drawing up a Plan C. It will depend on the next few weeks in terms of how Omicron spreads and whether hospitalizations increase. There are a lot of experts out there calling for increased restrictions. Although the government hasn't ruled out a full lockdown, we are likely to be a while away from that. But going a step further in terms of restrictions, so enforcing social distancing, making mask wearing mandatory in hospitality as well, are just some of the things that healthcare leaders are calling for example. The big question for the NHS really is whether Omicron will lead to increased hospitalizations, and when those increased hospitalizations will peak. So will they peak in the next few weeks, so peak over a very short period of time, during which that time the NHS really hasn't had time to prepare, and will it peak while staff sickness is at a staggeringly high level because of Omicron? Those are the things that will really affect the NHS. I'm going to steal a line from the Chief Medical Officer, Chris Whitty, for this. He suggested that people may want to prioritize their Christmas plans. So, for example, if your priority is spending Christmas with your friends or family, perhaps be more careful in the run up to that. So that includes taking lateral flow tests before you go to gatherings, stricter face mask wearing, those kind of measures. Obviously, the usual washing your hands and singing happy birthday as we did in the first wave, but essentially being much more careful with your infection control over Christmas.